The rainy season has caused a resurgence of dengue and leptospirosis cases. To tell us more about how to manage these illnesses, joining us now via Zoom is former Health Undersecretary and past president of the Philippine Society for Microbiology and Infectious Diseases, Dr. Eric Tayag. Good morning, Dr. Tayag. Thank you very much for joining us.
Good morning, Paolo. It's my pleasure.
Doc, I want to start off first with every time there is a rainy season, every time we see floodwaters, we actually see a lot of people going viral for swimming in the floodwaters. Of course, a lot of people associate that with the rise of leptospirosis. What's your personal reaction when you see those types of videos and, of course, the health risks that it all poses?
Well, it's sad to watch them swim when they really know the risks attendant to swimming or even wading in floodwater, especially if it is contaminated, because more people become at risk, Paulo, during the rainy months, especially when there's flooding, because you can get leptospirosis. It's a bacteria that can be found in contaminated water or soil. And this bacteria is easily found in this contaminated water or soil because there are rats, dogs, and other animals that carry the bacteria and spill it into the water or soil. And this is one way of getting leptospirosis. So if you have any scratches, better cover them, or if you can avoid flood waters, then this would be a protection for everyone who's in areas with heavily contaminated flood waters, Paolo.
Doc, the department has seen the decreasing trend in terms of the number of deaths with related to leptospirosis, 393 as of September 7, which is 17% lower than that recorded in the same period last year. Do you feel, Doc, that this is due to more knowledge from the public with regards to leptospirosis and, of course, the dangers when it comes to contaminated waters, especially during the rainy season?
Maybe it may be due to that particular reason that you are describing now, but it's more to it than that because it could be due to the infective dose or how soon, in fact, that they have accessed a health facility so that there can be early detection. What helps is that you actually prevent yourself from getting infected, and just what I have said is avoiding contaminated flood waters. And if this cannot be done, it's almost possible, especially for our relief and rescue operations teams that actually do their jobs, then you have to take antibiotics for this. It is prescribed, it's available, and so this may actually help reduce the number of deaths. But the number of cases and the number of deaths will be in the range of what we have seen in the past year as this year.
Doc, the MMDA has recently come out with a resolution, 24003, which bans leisurely swimming or wading in flooded areas and also urges the LGUs to have ordinances to penalize violators who actually do leisurely swim in floodwaters. Just how important is the LGU's intervention in matters like this to curb the spread of leptospirosis and, of course, people being infected by it?
While they have good intentions, this might actually give the wrong impression that you only get leptospirosis when you swim in contaminated waters. Even just wading in contaminated waters or even soil when the floodwaters have subsided can put you at risk for leptospirosis. In fact, leptospirosis is also an occupational hazard, and it can also make people at risk in recreational activities, simply just like, for example, hiking, kayaking, and this can actually also put you at risk. But more people are at risk during the rainy months when there is excessive flooding, Paolo.
Doctor, another thing that we like to talk about during the rainy season is the rise of dengue, which is endemic to the Philippines. And there have been moves to try and make sure that people are taking the right precautions towards addressing dengue. Right now, looking at the status of how the general public is reacting to the dengue threat, just how do you see the general public reacting to it at the moment?
Well, we don't want to have a populace that is already lackadaisical about preventing themselves against dengue because dengue occurs all year round. In fact, we had the worst global dengue uh, outbreaks last year in 2023, and hundreds of millions of people around the world are at risk, and that doesn't exclude us. And for the Philippines, more than 100 to 200,000 cases a year is simply not acceptable, despite the gallant efforts of government to make sure the numbers do not get as high as this. In fact, in June, it's the designated Dengue Awareness Month. We already drumbeat local government units to prepare for a bad dengue season. And that's why the forest strategy has always been the slogan for making sure dengue doesn't get bad for any given year. Forest strategy, Paulo, is simply searching and destroying mosquito breeding sites, self-protection measures that we don't get bitten by these mosquitoes, seek early consultation, and of course say yes to spraying when it's necessary. Of course, there has been lately a controversy whether the Philippines, the Department of Health, would introduce another type of dengue vaccine following the dengue
Yeah.
scare. But of course, the Department of Health, I'm confident that they're going to issue policies that will help us make an assessment whether this dengue vaccine will give us benefits and that this will be highly acceptable to many of those who's going to receive this new type of vaccine.
Doctor, before I want to touch on that as we wrap things up here because we're running out of time. One of the proposed suggestions in terms of addressing all of this, given the dengue scare in the past, is actually vector control here, as said by Health Secretary Ted Herbosa. Could you give us a brief explanation of what that vector control would be, and of course, what that might mean for the public, if ever?
Okay, mosquito control would mean two things. One is we are able to search and destroy mosquito breeding sites even before this become adult mosquitoes, because the life cycle of the mosquitoes is only about a month. And from the eggs that are hatched to the kitty kitty or the larvae, this allows us not enough time to actually control mosquito populations. It's difficult because you have to take care of indoor and outdoor settings to just search and destroy these mosquito breeding sites. It can just be an innocent garden with plants that have very big leaves that are able to hold water. Because remember, Paulo, these mosquitoes thrive and hatch eggs in clear, stagnant water. And we have bountiful of these settings. That's why it's very difficult to control it. And the behavior should be consistently deployed. And we cannot just be doing this for a week and forget it the following weeks. So it should be regularly done. The second one is to make sure we don't get bitten. And it's going to be costly, and it's costlier now because you have to, for example, get your mosquito sprays, your insecticide treated net, and your there are even windows that can be covered with these insecticide treated nets, mosquito nets, but that's going to cost. And the spraying, we will be vulnerable to insecticide resistant mosquitoes. And these are considered to balance the prevention and control of dengue. And that is why the WHO, as early as more than a decade ago, has proposed that maybe a dengue vaccine can be a game changer.
Yes.
But it was not a good story that we would have with Denvaxia,
Yes,
but
Doc.
now we are offered another second chance because of a new vaccine. But of course, this entails more assessments from the Food and Drug Administration, and that they are given the green light that this vaccine will be ultimately used.
Doctor, yes. Yes,
In
sorry,
the
Doc.
meantime, yeah, in the meantime, we would rely on this traditional mosquito control.
Doctor, thank you very much for that update. Of course, we'll find out more on that as the story develops. We'd like to thank you for your time once again. Thank you very
Thank
much
you,
to
Paolo.
thank you
Thank you,
very much for
Paolo.
former Health Undersecretary Dr. Eric Tayag.